All right. Hi, everybody. Dr. Rafich here, Vet Triage. It is 2:40 p.m. Pacific time, Thursday, September 5th. We are here for another exciting live stream. Yay. Thanks for everybody who watched on the playback. And thanks for those who subscribe and hit like and all that stuff. We're going to talk about what actual emergencies are. Now, this is not meant to go through a bunch of diseases that you normally would see in like a veterinary lecture or something at a conference. I think the live stream may have just restarted. YouTube. I'll just start over here. It's September 5th, Thursday, 2:41 p.m. Pacific time. I'm Dr. Shadia Rafich, owner of Vet Triage. We're going to talk about what makes up a real emergency with your pet. Now, this is not meant to go through specific diseases like you would see in a veterinary lecture or conference. This is just to talk about the bare bones, like what's really an emergency. And this is modeled after soldiers in war who get injured. If you have limited space in a hospital, let's say, you need to triage them, and so who gets the hospital bed, right? Because in an ideal world, everybody would get taken care of medically, but that's not always the case. So we need to talk about what actually constitutes an emergency when you're in sort of a bare bones environment. So life, limb, vision, and pain. And the pain I just added recently, but we'll talk about it. So the obvious one is life. Any condition that risks loss of life without intervention is an obvious emergency. And that could be a bunch of things. We're not going to go through every single type of disease. But in a scenario where the pet's at risk of dying, if not receiving care immediately, that's a risk for life. So a common example for that in dogs would be bloat, or gastric dilatation and volvulus, where the stomach twists on itself, and then you end up with a acute, peracute, severe surgical emergency. Those dogs need help, or they're probably going to die, and they'll die within hours, or by the time morning hits, they're gonna pass away. And so that's an example of one where their life is on the line. An example of one where life is not on the line is like an ear infection. Pet owners will look at a dog who's like scratching the ears, and they're like, "Oh my God, my dog is suffering," and whatever. And they're not really suffering from the standpoint of like, this dog is in agony. It's going to die if the ear infection is not treated. This is not an emergency. And even better, veterinarians like on Vet Triage can give advice for what to do to make your pet feel better, but you don't need to go to the emergency room for this. So those are two examples at the opposite ends of the spectrum. So that's life. Anything that's a risk for life, for losing life, that's a problem. Let's go to limb. Risk of losing a limb. So again, let's say your dog got hit by a car, really bad, a fracture of the femur, the leg is just shattered. And what happens in that scenario is the shards of bone that are there, the ends of the bones that are fractured, are sharp, and they can cut vessels like arteries and veins, and you can get life-threatening hemorrhage. Actually, I won't say life-threatening, because a lot of times it's within the compartments of muscles. It's not really life-threatening per se, although it can be. But let's just, for the sake of argument, there is enough bleeding to where the blood supply to the muscle, to the leg, is compromised. And so even if you fix the bone rather, you might lose the leg. And so you don't want to risk losing the leg. That doesn't mean that if your dog gets hit by a car and has a femoral fracture, you're going to get orthopedic surgery at 3 a.m. That's not the way it works. But what you are going to get is a pet who can be stabilized for shock, and then have the leg tended to minimize all that motion from the broken bones. So you put a bandage on them or something to help stabilize the fracture, get them ready for anesthesia and surgery, and then you have surgery in a day or 2 days or 3 days. But the point is that you can try to minimize the risk of losing that limb by getting them care immediately, as opposed to the less than ideal scenario of leg is amputated because of lost blood supply, because the pet had to wait a week before seeing somebody. In the meantime, he was thrashing around in pain, and all that motion with the unstable bone causes a problem with blood supply. So that's limb. risk of losing the limb. So an example where it's not an emergency is a ACL tear or cranial cruciate ligament, CCL tear. In dogs, yes, it's painful. It tends to be, although in dogs it's kind of much better tolerated than people. And ACL tear will cause pretty bad limping in your dog. It will not cause your dog risk of losing the leg. That's not going to happen. And so even though your pet is uncomfortable, it's not a life-threatening emergency. It's not an emergency from where you might lose the limb. And therefore, we can receive palliative care from vet triage to talk about how to make your dog comfortable and not and also try to prevent further trauma to the torn ligament. So that's an example where it's not an emergency affecting the leg. So that's limb. Vision or sight or eye. So loss of the eye is a massive problem, probably more so in people. I hate to say it, I guess. Animals don't need to drive a car. They don't have to go to work. They don't read. They don't watch TV. They don't do activities that humans rely on their vision for. A blind person, their whole life's changed now, right? It's a major setback. It's not ideal. And so the dogs that lose vision, though, they tend to, they accommodate. They get used to living environment at home. As long as they don't change a lot of stuff and you don't expect them to use stairs, they can pretty much memorize the household. And that's if they have no eyes, like no vision. The chances of your dog losing both eyes are very slim. If you lose one eye, you still have the other one typically. And so, but anyway, still, regardless of that, vision, we want to salvage it if possible. Well, I'm not trying to make it seem that like dogs are fine blind. It's not ideal, but they can accommodate it, grow accustomed to it way better than people can. It does not change your life to the degree that it changes a person's life. So anyway, if your dog has, let's say, for example, acute glaucoma is increased ocular pressure in the eye, and because the pressure, for lack of a deeper explanation, it starts to kill the eye and kill the vision of the eye. And you want to get that pressure down. And sometimes acute glaucoma is an emergency, not a life-threatening emergency, but it is painful. But more importantly, I guess, in this scenario, you risk losing vision. And for a condition that could potentially be treated. So that's an example where you want to get care right away, and that you need to go to the emergency hospital for if nothing else is open, or there's no ophthalmologist around. An example of an eye issue, it's not an emergency, is let's say they have a cherry eye, which is third eyelid prolapse. You can Google it. There are plenty of information online about that. But cherry eye is an example where it looks crazy. You have this pink thing on the corner of the eye, but it's not an emergency at all. They're not at risk of losing their vision. They can wait to see their family veterinarian weeks or even longer and get it taken care of that way. So that's an example where you're not going to lose sight. And the final one I added was pain. Now, in theory, conditions that are at risk of losing sight, limb, or life are going to probably have pain associated with them. So you're sort of treating those things anyway. But let's say, for example, your dog has a slipped disc in its back or its neck, and it's not paralyzed, it's not showing any neurologic deficits, but it's very painful, right? So it's not an emergency from the standpoint of the dog is paralyzed. We have to remove the compression from the spinal cord right now with surgery. It's more of this dog is in agonizing pain, screaming, can barely move because it's so painful. So, in that case, because especially, we want to make sure that we're humane to animals, we would consider that an emergency. Is it life-threatening? No. Is it risk of losing vision or limb? No. But it's so painful that you want to get seen for it. Versus, let's say your dog has an upset stomach. It's got some vomiting, some diarrhea. You can sort of hear and feel the intestines being gurgly. There's some uncomfortable, feeling there. Obviously, you feel gassy or bloated or have some belly aches, but it's not to the degree where you're going to rush to the hospital and be on a morphine drip, right? And so that's an example where, again, vet triage could help with palliative care until you can see your veterinarian for an appointment to get testing done. So those are my four categories of what are obvious emergencies. I don't expect folks who watch this who are pet owners to decipher, right? Because at the end of the day, you still want a doctor recommending stuff to you. So I wouldn't go as far to say this is a self-diagnosis video at all. I would say that when you talk to a veterinarian, like a vet triage, and they're like, it's not an emergency, and you as a pet owner are thinking, yeah, but my dog is like urinating blood, it's got to be an emergency. It's not. It's not an emergency, and they're going to explain to you why, and they'll help you with how to take care of your pet at home. So I hope that helps. Thanks for those who are watching. Thanks for those who hit like and subscribe. Feel free to share it. And I'll see you guys tomorrow, Friday, September 6th, for another one. Bye.